So tonight I'm going to talk about bringing your daughter to the gynecologist for the first time. And why would anyone want to come to a gynecologist? Well, first of all, when you get older and after you're sexually active, you need to go pretty much every year for your annual exam. We call that the well woman exam. And during that exam, we usually do a pap smear, and I'll be talking about that in a minute. But there's other reasons to come to the gynecologist and why your daughter might be interested in coming, and that is STD testing, birth control options discussions, if you have a vaginal itch and you need a vaginal infection diagnosed or treated, any problems with the breast we can take care of, problems with your periods, which are pretty common in teenagers, and pelvic pain problems. According to the American College of OBGYN, we should be bringing our daughters in between the ages of 13 and 15, not just to have a physical exam, but also to discuss these other things I was talking about, and to form a relationship with the gynecologist so that she is comfortable with a doctor she can go and speak to if she has any questions. We can be a good educational resource.
Hi, I'm Dr. Solomon.
So first I wanted to just briefly go over what an annual exam consists of, and that is a general exam. You get undressed, put a gown on, and then we check your lymph nodes, your thyroid gland, listen to your heart and lungs, do a breast exam, and then we usually do the pelvic exam, which consists of a speculum, and this is what a speculum looks like. They come in plastic and metal. We put some jelly on it, and we put that in the vagina, and we can get a pap smear, or we can look around in the vagina using that device. And then we do an exam called a bimanual exam, where we feel around with our fingers and make sure there's nothing enlarged in the pelvis. We feel the size of the uterus and the size of the ovaries. And then we write any prescriptions for birth control pills, for example, that might be needed. The pap smear itself, though, is a specific test for cervical cancer. And it is recommended that it's done within 3 years of sexual intercourse or by age 21. So the pap smear itself may not be needed with your daughter's first exam. But in case you don't think she's going to need it at all, just so you know, 28% of girls in the 9th grade and about 62% of girls in the 12th grade have reported having had sexual intercourse. So eventually she's going to need that pap smear. And this is what the position looks like to have a pap smear. She's wearing her gown, and the feet go in these things called stirrups, and the legs need to be open. And that's a little picture of what it looks like. And the pap smear consists of a spatula and a swab, and we get cells off the tip of the cervix and send them off to the pathologist. The pathologist looks at those cells under the microscope on a slide and tells us if there's cervical cancer. If I look in the vagina and I see the cervix looking like that, that's a good sign that there's some cervical cancer going on. Normally, the cervix looks very smooth and pink. And cervical cancer is a problem. We have 30 women a day diagnosed with it, and 11 will die every day from cervical cancer in the United States. But we are putting up a good fight now, and those numbers are coming down. We have learned that cervical cancer is caused by human papillomavirus. Human papillomavirus is a sexually transmitted infection, and it causes cervical cancer or precancer cells on the cervix also, and it can also cause genital warts depending on what strain you get. It is estimated that 75 to 80% of males and females will have human papillomavirus during their lifetime, so it is very prevalent. So what can we do about it? Well, besides abstinence and condoms, we are recommending that girls have HPV vaccines. And the most common one is the Gardasil vaccine. It's recommended for boys and girls ages 9 to 26, and it protects against the 4 most common strains of human papillomavirus. There's another vaccine called Cervarix that is also available. It's also a good idea to educate our daughters about the risks of sexual activity, and so I wanted to talk a little bit about other STDs out there. So chlamydia and gonorrhea are pretty common sexually transmitted infections. Chlamydia is estimated by the CDC that there is 1 in 10 female adolescents have chlamydia. When you have chlamydia, you'll see a vaginal discharge, pain with intercourse, or you may not see anything at all. And actually, when I diagnose chlamydia, often the girls have no idea they have it. Chlamydia can lead to pelvic inflammatory disease, and so can gonorrhea. So I'll tell you a little bit about that. The chlamydia and gonorrhea start off as an infection of the cervix, but it can make its way up the uterus and out the tubes. You can see in this picture here what the anatomy looks like. So the chlamydia and gonorrhea starts off at the opening of the uterus, but it can actually crawl up and out to the tubes, making you very, very sick. It can cause a fever, very severe pelvic pain, and you might even have to be hospitalized to have IV antibiotics. And it can cause scarring of the tubes, which can lead to infertility. Gonorrhea is the same kind of thing. You get a vaginal discharge, burning with urination, or sometimes you have no idea you have it. And it can also cause PID. Trichomonas is another STD. It's a vaginal infection, and you usually will see a frothy green discharge with it, and you may have an itch and odor. And trichomonas is interesting because people call all the time thinking that they have a yeast infection, so they go to the store and they buy their over-the-counter Monistat, and then they call and they say, I'm not better. And that's because trichomonas sometimes will feel like a yeast infection. So I bring them in, and sometimes we find trichomonas under the microscope. The chlamydia and gonorrhea is detected using a swab that we send off to the lab. So we swab the cervix with the speculum exam, send it off to the lab, and then they give us the results in a couple days. Trichomonas you can actually see under the microscope. It looks like little moving round things. So we can make that diagnosis right away. I wanted to show you a picture of herpes because it's very important that you know what it looks like. Herpes causes painful sores, and this is a penis, and they look like blisters. It's more common than you would think. 26% of women aged 12 and older show that they have been exposed to HSV2. That's the genital strain of herpes. But interestingly, people don't always know this, HSV1, which is the kind of herpes virus that causes cold sores, can also cause genital herpes. So if you were to have oral sex with somebody who has the type 1 of herpes with the cold sores, you can actually get it on your vagina. Other STDs that I wanted to mention briefly are syphilis, which is less common, and that causes painless sores. So herpes, you get painful sores. Syphilis is painless sores on the vagina or penis. And HIV, of course, everybody knows, is the virus that causes AIDS. Now, syphilis is treatable, curable, and HIV, as you know, is not. I would also want to talk to your daughter about birth control options. And this is a good conversation to have early on because we know that half of unintended pregnancies actually occur in the first 6 months of exposure to sexual activity. So we want our girls to know birth control options before they have sex. And of course, the very best one, I'm sure you've all heard a million times, abstinence. Abstinence is the only thing that's going to protect you from STDs and pregnancy, for sure, 100%. But since we saw the statistic that our kids are having sex, the next best thing is condoms. And condoms are so important because they will protect you against most of these sexually transmitted infections I just went over. You have to use your condoms, but there's some other birth control options that you can use with your condoms. And I wanted to review those with you too. We have birth control pills, we have birth control rings, we have birth control patches, and these are all hormonal. And so what that means is they'll be very good for your periods. So your periods will be painless and light. And a lot of our teenagers come in because they're having painful periods or heavy periods, and putting them on a pill usually fixes the problem. If you're not good at remembering to take a birth control pill every day, then we have the vaginal ring called NuvaRing. This looks like this. Then it's not blue, but it's just a flexible ring, and you stick it in the vagina, leave it there for 3 weeks, take it out for a week, get a period, and then you put a fresh one in. So that's easy for teenagers to remember. And then there's the patch also, which you put on weekly. It's like wearing a Band-Aid. We have Implanon implant. It's kind of like the old Norplant. We put it in the office, in the arm. It's just almost like an injection, and it's good for 3 years. That has progestin in it. The two main hormones that we use in birth control is estrogen and progestin. So Implanon is just progestin, and then Depo-Provera, those are the 3-month shots. That's good for teenagers who can't remember also. and you come to the office, get a shot every 3 months, and that has progestin in it. Very effective, mainly because you don't rely on somebody to remember something. The IUD has actually been discussed lately. We should be using it in younger women. We used to think that it was only for women who had had babies, but they have changed that now, and now they're recommending it for younger women. There's 2 types of IUDs. There's a 5-year IUD called a Mirena, and then we have a 10-year IUD called a Paragard. The Mirena, the 5-year plan, has a little bit of progestin in it, and so it helps your periods also. The 10-year IUD sometimes can cause your periods to be more painful and heavier. So we'll talk about all that if you're interested. Then there's the over-the-counter products. We have sponges and spermicides and foams. And then there's a diaphragm, which used to be more popular years ago. Now it's less popular. It's kind of a pain in the neck because you have to wash it every time you want to use it and insert it before sex. But it's still very effective and a good option for women who don't want to use hormones. If you use nothing, then 85% of the time you'll get pregnant. But if you used a birth control pill perfectly, it's only 0.1% chance. So if you have an itch or a vaginal discharge, you would want to come visit your friendly gynecologist so that we can make a diagnosis and get you treated. And the most common vaginal infections are a yeast infection, which you've probably all heard of. And with a yeast infection, you usually see cottage cheese-looking discharge, real clumpy, and itchy, burning vagina. Another common vaginal infection is called bacterial vaginosis, and this is a vaginal discharge with a fishy odor. So when you think about odor, think about bacterial vaginosis. Yeast infections and bacterial vaginosis are not sexually transmitted, and they're both easily treated. Trichomonas is another vaginal infection that is sexually transmitted. We talked about it before, but it can mimic the same symptoms as your yeast infection or bacterial vaginosis. I also like to educate our daughters on breast exams. So when you bring them in, I can show them how to do a breast exam. And if they have any problems, like noticing breast lumps, nipple discharge, or breast pain, we can talk about that. Young girls usually have irregular periods. That's the most common thing I hear with teenagers. When you first start having your period, usually around 13 or 12 or 13, the periods usually don't come once a month. You can have more than one period in a month, or you can skip for months at a time. And that's pretty common for the first couple years when you start your periods. And so usually that's just normal. We don't have to treat that. But if that continues, then we may want to address that. And then girls who have pelvic pain come to see me too. And an example of one of the causes of pelvic pain is endometriosis. Endometriosis is implants from the lining of the uterus that somehow get into the pelvis where they don't belong, and they cause pain. The big hallmark for endometriosis is painful periods. And girls get ovarian cysts frequently too. And this is a fluid-filled sac that forms on the ovary. And sometimes they get very big and cause pain. So we make that diagnosis with an ultrasound. And usually we just watch them, but we want to make sure they go away and don't get bigger. And just to end, I think this is probably what the speculum will look like to you on your first GYN exam. So thank you all for coming tonight, and I'm happy to answer any questions.